Welcome to Fill the Void podcast, where we discuss unhealthy human habits caused by the society of consumption. Meet Erica Hornthal, a licensed therapist specializing in the powerful connection between movement and mental health, founder and CEO of Chicago Dance Therapy and author of her book, Body Aware. She guides clients to express emotion through movement. Welcome, Erica. How are you today?
I'm doing so well. Thank you so much for having me.
Thank you for being here. The first question I want to ask you is, what inspired you to dedicate your career to body awareness? What's your story?
I don't think it was an intentional choice when it came to the body awareness piece. I loved to dance and I loved listening to people and helping them feel heard. And so at the end of the day, I was able to merge those two passions together. And as I went to school for dance movement therapy and started working as a dance movement therapist, I think it just continued to highlight the need for not only body awareness, but body awareness for mental health. That even though we're talking more and more about mental health, and in many ways the stigma has decreased, there is still so little known about how the way we move influences how we think, feel, and behave. And that at the end of the day, it's still the gold standard to change our behavior in order to change our thoughts. And oftentimes to change vice versa, right? To change our cognition, to change our behavior. But what people don't realize is that what creates cognition is this embodied piece, how we move, the sensory input that we receive. It's a huge part of our mental health, a huge part of the way we think. And that really started to emerge, maybe about 5 or 6 years ago. And that's really when I started to focus more on this body aware piece of how we can really look to change the way we move to support the way we think.
I think it's a really interesting topic. And even more nowadays that I feel we're very disconnected from our bodies and our physical, because we are always in our heads.
Yes.
Even with everything that's happening in the world, like stress, the lifestyle we have. How can you explain what is the body-mind connection? Like, what does that mean?
The way I like to simply put the body-mind connection is that the way we feel influences the way we think, and the way we think influences the way we feel. And while they're always connected, mind and body are connected. They're not separate because they exist in the same space, same person. They don't respond the same way. They're not connected the same way. They don't even speak the same language. Body is sensory. Mind is judgment, perception, thoughts, overall perspective. So I think just at the heart of it, we want people to understand that it's all connected. Physical is connected to emotional. Emotional is connected to physical and spiritual. But that mind-body piece is not something we have to buy into. It's not something we have to learn. It is something that is inherently part of us. But as you mentioned, we turn off a lot of it, right? We turn off the body, we tune into the mind. Sometimes we do the opposite. We have people that overly tune into body and then, silence the mind, which sometimes seems odd, but it is possible. Realizing that they're always connected, that they're always in communication. They're just not always translating the information accurately.
And what's your overview on the world now, and like with your patients, with your clients? Do you see there's an increase in mental health issues, like whatever issues there is? What's your view?
My overall view is really that our ability to manage the stressors is what's the main problem. But with that, we have more problems at our disposal. The more we have at our fingertips, whether it's technology, I think just options, we have so many options that creates anxiety. If you walk down the grocery store aisle, I always joke, the deodorant aisle. I mean, there are probably 100 options. It's really overwhelming.
Yeah.
So as opposed to before, centuries ago when there was no deodorant, so it's like, we've created a lot of the anxiety that we experience. But I think, again, at the heart of it, it's that we don't know how to manage what we're feeling as it's coming up. So a lot of what I end up seeing is anxiety. People say, oh, I have anxiety. I have a lot of anxiety. Rightly so. I think if we're not experiencing anxiety, that's a signal, right? That's a symptom in itself. Oh, I'm not anxious. Everybody's anxious to some degree, but for it
Yeah.
to really get in the way of our functioning, that's a huge turning point. And I think for me, that's a lot of the mental health epidemic that we're seeing. Yes, trauma is a big part of that, but um, Levine says, I'm thinking of Siegel, but Peter Levine, right, big expert on
Yeah.
trauma, says, trauma is anything that's too much too soon. And I think that is society. We're constantly getting too much too fast. And so in a very general sense, you could say everything is a little bit of trauma, maybe small t as opposed to big T. But at the end of the day, it's how well you cope with the information that's coming at you. And if you're not, how do we limit it? How do we set boundaries? How do we express what we're feeling? How do we just sit with what we're feeling? The more distraction we have in the world, the less capable we are of doing that. So I think that for
Yeah.
me is the big epidemic. It's, yes, we're struggling with mental health because we can't manage what we're taking in because we're taking in entirely too much.
Exactly. Yeah, that's why all these distractions, I call them the ways we humans feel the void.
Yes.
Because sometimes it even happens to me that I'm feeling anxiety, but I don't even know where it's coming from. How do you call that? Where is that coming from?
Yeah. Well, I love the title of the podcast, right? Because while on one end, that can be we're filling something that we require belonging and, a sense of community. We want to fill that void. But what you're speaking to is filling this void where we feel bored, we feel lack of connection to self, that we look to satiate that. We look to fill that with food, with technology, with stuff. And that doesn't make us any happier. It doesn't make us any more content. So I think learning to fill the void when it fills you up, right? Not learning to fill the void when it's distraction or purely, we all deserve a little bit of distraction, but not when it's to override the feelings, right? What I'm feeling is so intense. I need to fill this, right? I need to stuff it down or shove it away so that I don't have to feel this, as opposed to actually leaning into that, allowing yourself to feel what comes up is actually the way to move through it, right? Or to overcome it, or maybe even let it go. So I think there's a lot of ways to address filling the void.
I love that approach. And how is movement related to mental health? Why is it such a powerful tool in therapy?
So most people think of movement when it comes to exercise. And so I think there's that narrative that says, well, you release endorphins and serotonin and you feel better when you exercise. So if you're suffering from depression, exercise, right? If you're suffering from anxiety, exercise. There was new research that came out that said basically certain forms of exercise like dance and yoga can be better than certain medications. In theory, that sounds great. I think what we're missing is that we are wired through our movement. So from the first 3 years of life, how we interact with the world and the people around us is entirely through movement. It's through sensing. It's through input and feedback, right? And as we, transform into these cognitive beings, again, movement kind of takes a back seat because there's something that says, well, I can communicate now. I can talk now, so I don't have to worry or rely on my movement unless, I absolutely have to, which a lot of people do, So I think that missing piece that people like Bonnie Bainbridge Cohen, Laban Bartenieff, a lot of these movement analysts, individuals that study body-mind centering or created body-mind centering, understand that our reality comes through by how we move and how our body is connected, how the tissues, the fascia, the cells, it's not just to create the body that then moves. It's always looking at that. It's always knowing that to a certain degree, we can change the way we show up in our body. And that has a huge impact on how we think and how we show up in relationship to others and our environment. So it's not just exercise. Sometimes exercise can be the pattern that we need to change, can actually perpetuate a lot of the dis-ease that we're feeling. But how we stand, how we sit, the response we have to something. Notice the affect, the face, the facial features that change, the eyebrow that raises, the catching of the breath, the holding of your breath. It can be your pace, how you walk, how fast, how slow, how much weight you carry as you move through the world, not just, physical weight, but the pressure. These are all aspects of movement, and yet we don't bring them into the therapy room. We bring somatics. We talk about, well, how does it feel in your body right now? Talking about this, how does that feel? If you could show me what would this look like? We even have nervous system regulation tactics and tools to help us move through something, but we don't break down the characteristics of what it looks like to move in our body. And people are doing it, but it's not part of the mainstream conversation. And that's really something I hope to change.
We don't acknowledge. It's just like something else that we're doing, but we never come and analyze the movements.
Right. And I think that word analyze triggers some people. They think, oh, well, someone's going to show me or tell me or judge me. And I always feel the opposite. It's my job to hold space and create opportunity for people to just witness it in themselves. So I can say, oh, what's the quality around your movement? Just asking that question, not many people know what to say. So I can add, here's time, here's space, here's weight, here's the flow, here's the shape of your body. What do you notice, right? And then when you notice those things, how does that relate to the cognitive difficulties you're experiencing, right? The emotional difficulties. Because I use the example of, it's very rare, if ever, that you'll meet a type A personality who's very loosey-goosey in their body. It just doesn't, or if there is that disparity, if there is that incongruence, that sometimes can be a sign of mental illness, right? Typically, there's that congruency of a type A being very uptight in their body, right? In their clothing, in their gestures. Yeah. So we can learn to adopt other ways of moving in our body to actually create more resilience and emotional capacity in our minds.
And so the way you work with your patients, it's talk therapy, but acknowledging the movement, or you make exercises of body movement as well.
Yeah, it really runs the gamut. For some clients that come in knowing full well that we can dance, we will focus on dance. It's not technique, it's not skill, it's not choreography. But we can focus on that creative aspect of the art form of dance. Most of my clients coming in don't have any awareness of their body. They know something's not working, something's not right when it comes to their emotional expression, and they're feeling it, that they're holding it. They feel the tension, they feel the dis-ease as it sits in the body. But just bringing it into the conversation, meeting them in their minds, because that's where a lot of the anxiety is, and then bringing the awareness of, what do you feel as you're talking about this? Can you just take a break and notice how your body is moving right now? How well are you moving? What parts of you aren't moving? And so starting to bring the body into the conversation and then integrating it into the therapy. Again, as a dance movement therapist, it looks, I don't want to say very different, but it does look different compared to maybe somatic experiencing, which is something people have a lot more exposure to. One is a little bit more intervention. One is a little bit more proscriptive versus prescriptive. One is a little bit more proactive, I think, versus, or like preventative versus like intervention. They're both amazing. I think people just need to know they have different options. Again, dance therapy is really about the therapy. It's the relationship. And so working with someone that can support that movement piece in the relationship can make all the difference for a lot of people.
A wide range of expertise, like including cognitive and movement disorders and trauma. Mm-hmm. Can you delve into these topics a little bit, and how's your work related to this?
The work really found me. So, when we're early practitioners, everybody talks about finding a niche, find your population, find your kind of comfort zone so that you can really create a specialty. So for a while, I really resonated very deeply with individuals that had some form of dementia, Alzheimer's, Parkinson's, movement disorders like Huntington's. Sometimes there's that overlap. Not everybody has dementia, but oftentimes they overlap. Mm-hmm. And that felt like my niche for a really long time, mostly to create a brand for myself, get my name out there, and also help educate the public on why dance therapy was so necessary. but especially for people that don't have formal language skills, right? Or they're losing their right, more like higher level functioning. And then as I started to work in private practice, again, the work kind of found me. So I would have people call and say, I'm recovering from an eating disorder. I recognize that I need to have a healthier relationship with my body, even though it feels like the enemy. Someone recommended dance movement therapy, or I was seeing a dance movement therapist in treatment, and now I'm looking for someone outpatient. So I always made it very clear that, especially if it was kind of the first person I was working with, I would say, well, this is newer territory for me. Let's make sure that you have a supportive team, so that I wasn't the only one until I felt like I had some expertise underneath my belt. Same thing with trauma. I didn't have a lot of formal training in trauma. That's changed. I have a lot more experience, but people were coming saying like, this is what I'm noticing. I don't know where to go from here, and no talk therapy has been able to help me. So instead of saying, oh, I know what to do, I could just say, oh, I have the capacity. I would love to be able to help and explore this together. And so somatic work, body-centered work really goes hand in hand with trauma because there's that disconnect. And what we really need to do is form a relationship with our somatic being. And so, if there's specific traumas, I can certainly outsource those things where that comfort level is. But it's allowed me to work with a lot of different populations, a lot of different people. And again, focus on connecting, rediscovering mind body so that we help use movement to support our mental health.
I love it. Remarkable. What challenges do you often see in clients facing when it comes to the mind body connection? Like, what are the challenges that they're experiencing?
I think the first challenge I see, it's really hard to stop talking. Right?
Yes.
I mean, I recognize that. I'm a talker. Yeah. I see my own dance movement therapist, and we pretty much talk the whole session too. But it's meeting me where I am and what I need, and recognizing when words are getting in the way, I can, take a step back. I can pause. I can be silent. But that's one big thing. When I have a client that comes in and is recognizing that they're not really connected to their body, just asking a simple question of like, what do you feel? What are you feeling in your body? Well, I feel anxious. Like, okay, what does the anxiety feel like? What do you feel in your body? And sometimes just going back to the drawing board of, let's do some sensory exploration, right? What does it feel like to touch your clothing, right? Tell me what that feels like. Oh, it's soft, it's loose, it's, so it's finding the language of the body that's hard at first, that we're so accustomed.
Because the problem I feel it's even in our language, because we are unable sometimes to express what we feel in the best way, in a correct way. So the deficiency is in the language.
Yes, absolutely. Like, how many languages don't translate to English because it's an experience.
Yeah.
It's there are no words. There are no English words for it. So then here, we're speaking English for the most part, and there's no word to describe it. So that's the other thing. I'm like, well, you can't speak from a dictionary or a language that's unknown. So how do we get to familiarize ourselves with this new language? I think the second thing is the fear and the judgment that their body is going to be critiqued, that their dance skill is going to be, outed. Just that we're going to be judged, and I'm not there. Really, nobody should be there for that reason, but I'm not there to judge their movement. We're not on So You Think You Can Dance. This isn't Dancing with the Stars. I don't know what it feels like to be in your body, but unless you figure out what it feels like, I'll never know. I can't help you if you don't know what that feels like. And I think once those two things, which are not small, start to turn around, it really opens so many possibilities, so much potential. Those are the big ones for me. I don't see too much else getting in the way other than, people's like own limitation, right? Self-doubt and, oh, I can't, or, oh, I don't do that. If you come in with potential and possibility, which we all have, the work speaks for itself. It starts to unwrap pretty quickly.
And now, could you tell us a little bit about your current project, such as your first book?
Yeah, so, gosh, it seems like a long time ago now, but at the end of kind of the crisis that was the pandemic.
Yeah.
I published Body Aware. It was something that had been in the works well before the pandemic, but for better or worse, the pandemic actually allowed me a lot of ample time to write. And, it was a couple things. One, it was a way for me to share dance movement therapy with a wider audience. It was an opportunity for me to specifically share my own methodology and kind of techniques outside of my own practice area, which is usually limited to my region, to the Midwest, to Chicago or Illinois. And it was also an opportunity to, again, create a larger dialogue around movement and mental health. So kind of, I guess, 3 parts to it. And, from someone who didn't grow up writing, I never thought of myself as a writer. It wasn't a goal to write a book. It was a ride. It was a trip of navigating the literary world and, choosing to go down the traditional route of traditional publishing rather than self-publishing. Yeah, it was exciting, and it's something that's there forever now. My agent always talks about it being an evergreen, that we're not looking for something that's just quick fix and trendy and that's it. This is something that people will pick up forever. You can open just to certain parts and find something. You can read it cover to cover. It's really, you'll get what you need from it as you read when you're ready.
Yeah, it's your magic shared for the world, basically.
Yeah. It's like my own perspective, which resonates with a lot of people and in many ways won't, and that's okay. But, there are a lot of somatic books. There are a lot of body awareness books. There aren't a lot of dance therapy mainstream books. And so I felt like it's, certainly my take on the schooling and the experience that I've had. And it's resonated with so many people, which I really appreciate.
And do you have like a favorite part of your book that you want to share with our listeners?
I think now the favorite part that I come back to is where we've redefined movement. That's a really important chapter, which kind of sets the tone because, again, we have this stigma or assumption of what movement is, and we forget that movement is just a shift or a change in posture or perspective. So quite literally, when we feel stuck in our minds, it benefits us to move the body in some way just to change our perspective, just to shift. Movement creates momentum, which creates initiation, which is something that a lot of us feel challenged with. It's not that it's not that we're unmotivated. We're just motivated for something that maybe feels counter to what we want to do.
Yeah.
So I think that's my favorite part. I mean, there's a lot in there that I like. There's a lot I think I've forgotten because as I was writing, again, we were in a pandemic. But that's the part I come back to over and over again that I think has been helpful for a lot of people, giving ourselves permission to redefine what movement is.
And talking about the pandemic, I can imagine it was also like a prohibition of movement in a way, and being able to be in contact with other people.
I think it's not really coming out until now. So the thing is, we were all in survival mode. So whether we were thriving, because some of us were like, this is great. I don't have to go to work, or maybe I'm working from home and I'm an introvert, so it feels better to be home. That worked until it didn't work anymore, right? But some people thrived. Some people lost weight. Some people gained weight, right? Some people set better boundaries. Some people lost their boundaries. It impacted everybody in their own way. But I feel like now I'm seeing more and more clients kind of realize now I need to prioritize my mental health, right? I'm really experiencing X, Y, and Z. And I think a lot of it is the aftermath of the trauma that we just all went through, we're slowly coming out of survival mode, but it doesn't feel safe in our bodies to do that, even though for most of us it is. It's safer, right, than it felt before. It's about navigating this new norm, this new world post-pandemic, and finding a sense of connection and safety and stability within my body so that I can return to the things that once brought me joy or find new things that bring me joy. Diagnosis-wise, I don't think for me it's that different. Maybe there's more kind of like that PTSD or just adjustment disorders, right, that we're seeing. Anxiety for sure, depression. But I think, again, it's that inability to regulate the nervous system because we all just came out of this collective trauma. And some of us are still going through our traumas or new traumas around the world. It definitely played a role. And I think, like you said, I love that, the prohibition of movement, that some of us actually moved more during the pandemic. We were hopping online, we were taking dance classes, picked up a guitar, started singing, TikTok exploded, people were doing dance challenges. Like, the need to express was overflowing. And so we are seeing movement, but then we're seeing a decrease in other movement, connection to others, moving through our environment, walking outside without fear of bumping into someone or seeing someone or breathing too close to them. It stifled our movement in so many ways. And so we focused on the expressive movement, not so much on the functional movement. And that does have a huge role in how we think and feel.
Listeners that are interested in deepening their mind-body connection, what advice would you give them to incorporate movement in their daily lives?
So I talk about acing your mental health. So the A for me is awareness. That's the number one thing. It's like, at any given time, we have the ability to become more aware of how we're moving in our bodies, especially when we're feeling overwhelmed. When we're in crisis, we lack the ability to notice that. It's kind of, we have to calm down first, right?
Yes.
But as we're ramping up or we're noticing, oh, I'm really anxious. Why? How? I'm moving really fast. My movements are tight. I'm constricted. I'm tense. Let's interrupt that. So the C is to challenge or change the movement. So if my shoulders are by my earlobes, I'm going to lower my shoulders. If my breath is really short, I'm going to try my best to, decrease the pressure, breathe into my belly. If I'm really tight, I'm going to wiggle my body or shake it out, right? And then we can focus on the E, the expression and the expansion of movement. So that can sometimes be just expanding on, well, I was breathing into my belly, but that's moved into a stretch. Now I'm reaching my whole body out. Or that can be, long term, right? That I'm recognizing that this type of movement is really beneficial for my mental health. So I'm going to make it part of my daily routine. Or I'm going to take up a new movement practice once a week. So ACE, awareness, challenge, expand. Those are what we need to be doing in order to start bringing movement into our everyday so we can start to use it to support our mental health.
Amazing. Very useful, these 3 points, and to have them present. And even, like you said, scheduling a routine and making the space to have that moments that you need to feel better mentally and physically. So balancing, this is like a personal question, balancing a private practice, public speaking, family, personal pursuits, everything can be challenging. How do you manage all these various aspects of your life?
I've learned to set really, really good boundaries, and not so much with other people, but more so with myself. At least before the pandemic, for me, it was like, the more I could do, the more opportunities opened. That's what it felt like. Someone wants me here, I'm going to say yes. Someone wants me here, I'm going to say yes. And it did feel good. I wouldn't say that I was pretty good about not overextending myself to the point of burnout. But with COVID, even right before COVID, literally before the lockdown, I had just had my second child. So I was already ramping up to slow down, slow down. That sounds funny, but
Yes.
It allowed me actually to really intentionally say no to a lot of the things that I kept saying yes to, that I was okay saying yes to for a long time, and then slowly started wanting to say no to and wasn't really sure how. So COVID was like, nope. And actually, other people were saying no to me. Sorry, you can't come to the building right now. Okay, great. I was like, that's gonna hurt my finances a little bit, but I get it.
Yeah.
And so eventually I could say, well, I didn't really want to go there anymore anyway. So, I shifted who I was working with a little bit, again, because I had wanted to for a long time. But I think I've just cognitively recognized when I'm hearing no, and then physically feeling the no, so that it's
so
like,
important.
no, we don't want, no, this isn't for you. Or the need to say yes and recognizing that's the people pleasing. Like, ooh, it's really easy for you to say yes right now, but you know what? That's actually a sign that you need to say no for me.
Exactly.
Yeah. So better
interesting
boundaries.
because in the cognitive, maybe you feel the no, but you just like go past over it as if you weren't hearing anything. And that's the problem.
It's all habit. So it's like I'm so conditioned for a while to say, yes, 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 yes. I needed to slow down to really hear my body saying no. I was just quick to the, yeah, okay.
Exactly.
Oh, wait a minute. I should probably check my calendar. I was like, oh, I should probably actually stop and listen. Is this a yes? So I think that's it. So it's not about doing it all. It's about making space for it all at the right time. Like, I've learned to have much better, and I go back on this sometimes, but for the most part, I have family days, right? My son is still young. He's not in school full time yet. So I've learned those are my days, right? Like I have days with him, and not to feel, well, I can feel guilty, but to really sit with what comes up if a work opportunity comes my way, that, okay, it's not for today. It's not for today. And I can come back to it tomorrow. And if I missed the opportunity, then it wasn't meant for me. That was very hard for me to do even 5 years ago.
To let go of the thought that if it wasn't meant to be, you just have to let it go.
Yeah. But that's made all the difference. I don't know that it's certainly not easy. It's not easy to, quote, balance things. But I recognize too that when I'm physically off balance, that is a sign. So keeping my body moving and challenging my physical balance has been very helpful for me to recognize when emotionally I'm off balance.
Erica, my last question to you is, where do you see the future of dance movement therapy heading? Also, because I want to include here all the non-conventional therapeutic methods. What do you think about that? Is this something that could be once integrated with also body-aware therapy? What do you think about these things?
The field itself is really flourishing globally. There's lots of new programs, not just practices, but actual educational programs that are popping up all over the world. Dance therapy as a field has always had a bit of an identity crisis. So it's a challenge to be in a field that doesn't always 100% know who it is, in a sense, right? We're dance, we're therapy, we're somatic, we're movement. We've got some therapists that are very connected to dance. We've got some therapists that aren't, but are very connected to movement. So within the field, it's a little bit of an identity crisis, I kind of joke. But I think on the whole, we are going to find that therapies like this are what's been missing for a long time from the mainstream conversation. And I don't know if it will ever interrupt the gold standard, let's say, of cognitive behavioral therapy. But it's my hope that it just has a seat at the table, that it becomes more mainstream so that it's known, people can refer to it, they can offer it as, a full-fledged therapy, not just adjunct or supportive. Because at the end of the day, dance movement therapists have that education. It's not just one intervention. It's a framework. It's an orientation. So I think it's here for the long run. It's just that in order to make ourselves, for better or worse, relevant, to stay up with the times, we have to meet our clients and the field in the language it's using. So you might notice, we're talking more about trauma-informed, or we might be latching on to the word somatic. Our credentials kind of speak for themselves. We have a hard time marketing ourselves. And so it's really on a lot of the individuals to do that. Hence why, one of the reasons I'm here today, right? But I know that it's more well-known now than when I started in the field, which was more well-known than when the field originally started. So we're heading in the right direction. I think it's a lot of figuring out who we are and how to share it with the world.
Thank you so much, Erica. Thank you for all these remarkable insights. And I know this conversation will shine light and be helpful for so many people.
Oh, thank you so much for having me. It's been a pleasure.